Yeah, so I think the robots I use as an additional tool to all the things that I do already. So I do a lot of hip replacements, and the various checks and measures and checkpoints that I use as my standard practice for doing hip replacements. And the robot is another tool to help me get things even more accurate and reproduce what your anatomy should be to hopefully improve your functional outcome following your hip replacement. I've always been somewhat obsessed with the idea of preoperative planning. So I've always had calibrated x-rays, which I can then plan a patient's hip replacement. It allows me to decide before we've even entered the operating room what was going to work, what's not going to work. The advent of the robot was just a natural progression, really, because previously I was only able to plan in 2D. For what is a 3D structure, whereas the robot suddenly opened this world of being able to plan really, really accurately in 3D. As part of the process of planning for the robot, we take a CT scan, which is a very accurate 3D picture of your hip and some of the structures surrounding the hip joint. That's then analysed by the Stryker team, and Stryker are the company that make the robot. That's analysed by the Stryker team to put that information into something that the robot can understand. And then we can then map out the inside of your hip joint and the outside of the hip joint and various anatomical landmarks on your hip during the operation, so that then the robot knows exactly where your hip is, exactly what your leg lengths are, exactly what the width of the hip is, and also the orientation of the components. So it's just a really, really accurate way of positioning implants. And so from that side of things, it was a very obvious step for me to try the robot when it first came out, and I was really impressed with, sort of the accuracy that it gives me.